The main finding of the study concerns with increase of over 25% in both the number of cardiac arrest calls and acute coronary syndrome calls of people in the 16 to 39 years of age group during COVID-19 vaccination rollout in Israel, January to May 2021. What they did was, instead of self-reported events like we have VAERS, they actually went to the database for the emergency services and looked at that data. I think we should also do these kind of things over here. The study's time period, what they did was they divided the cohorts into 3 groups. They looked at these cardiac events in this population, 16 to 39, before pandemic. So that was their cohort 1. That was 40 months of normal period. This was from January 2019 till February 2020. So they took the time from January 2019 till the February 2020 as a normal time. And they calculated these cardiac events during this time and saying this was a normal time. Then from March 2020 till December 2020, they took that as pandemic period where the vaccines were not yet in the play. Then they took 2021 January till June 2021, and they took that as COVID time, wave 3, plus vaccination time. And they compared these events in this age group in these periods. That is what they did. And what did they find? They found, I'm quoting from the study, the main finding of the study concerns with increase of over 25% in both the number of cardiac arrest calls and acute coronary syndrome calls of people in the 16 to 39 years of age group during COVID-19 vaccination rollout in Israel, January to May 2021, compared with the same period of time in prior years, 2019 and 2020. So when they compared it to the normal time, they saw that there was an increase in the calls. That's it. That's what they saw. And you would see in the criticism that people said, actually, let me just read it just for the context. So if you see here, there is a criticism here where they said, what they found was there was a significant increase in these events for young people right around the time when Israel was vaccinating its population, but no overall association with COVID-19 infection rates. They suggest the vaccine may be the cause. Now, if we go to the paper itself, you would actually see they do not suggest anywhere that it is a cause. They're actually saying, while not establishing causal relationship, they say that right in the abstract. The finding raise concerns regarding vaccine-induced undetected severe cardiovascular side effects and underscore the already established causal relationship between vaccine and myocarditis, a frequent cause of unexpected cardiac arrest in young individuals. And they actually give reference to other studies that have said this, and they said our study kind of underscores that. And then they say in the criticism, they go on to say that the Israeli government should immediately investigate the issue to make sure the vaccine is still safe for young people. And if you see here, they do say that the government should look at myocarditis in youngsters and investigate it to make sure that is there any harm that is happening that we are not looking at or we are not aware of, and can that be preventable? Remember, I had been doing this discussion from December of 2020. This is not about saying that vaccines are good or bad. It is about saying if there is a possible harm, we should then see how to get ahead of it. Let me actually show you. This would be critical to better understanding the risk benefits of the vaccine and to inform related public policy and prevent potentially avoidable patient harm.